is the Emergency Medical Minute.
So let's talk about daylight savings time and sleep deprivation. Does it really make a difference that the time change of 1 hour can cause issues with either medical health or accidents? Well, it's increasingly common and increasingly clear that insufficient sleep and disrupted circadian rhythms are a major health problem today. In the past, I saw at least one result that showed something like $56 billion and 24,000 deaths, as well as 2.5 million disabling injuries being related to some kind of sleep deprivation. In fact, Chyrnobel, Exxon, Valdez, and other major disasters, including the Space Shuttle Challenger, have been linked to insufficient sleep by either supervisors or staff. So we as a society are chronically sleep deprived. How can small additional losses of sleep have any significant public or individual safety consequences? Well, they've actually done some studies on this. Two really interesting studies, one in the New England Journal of Medicine back in 1996, looked at Canadian traffic accidents. Our friends in Canada keep a very detailed database on traffic accidents, and they used several years worth of data and looked at something like 1.3 million traffic accidents, so they had a huge amount of data to mine. They looked at it over several years, and if we remember, in the spring, we lose an hour when we spring forward, and in the fall, obviously, you gain an hour of sleep when we fall back. So what they did is they looked at 3 consecutive Mondays: the Monday before daylight savings time, the Monday immediately after, so just like today, and the Monday a week later. And they looked at the number of traffic accidents that happened. And out of this huge database of 1.3 million accidents, what did they find? So in the spring, when people lost an hour of sleep, the day immediately after daylight savings on Monday, there was 8% more traffic accidents than normal. And the 2 days, the Monday before and the Monday after, were completely the same. So that's interesting enough, but in the fall, when you gained an hour of sleep, the interesting fact was that the Monday immediately after gaining an hour of sleep, there was 8%, again, less traffic accidents, and it was normal the week before and the week after. So small changes can have a pretty significant difference, and in fact, the investigators felt that the effect was actually due to actual loss of sleep and not from disrupted circadian patterns, given that the findings seemed to decrease and the risk of accidents decreased with an extra hour of sleep during the fall back. We also know that it affects myocardial infarction and heart attack. So another New England Journal study in 2008 looked at the incidence of MI during the time change. And this was done from another large database, this time in Sweden, where they also like to keep immaculate records. And what they did in this study was very similar, but they looked at the entire week before daylight savings, the week of daylight savings, and the week afterwards, so 3 different periods. In the spring, when you lost an hour of sleep, there was an increased risk of heart attack that was significant for the first 3 work days, so Monday, Tuesday, and Wednesday. In the fall, when an hour of sleep was gained, there was a decreased risk of heart attack on that Monday compared to the week before and the week after. It only gave a protective effect for the one day. Tuesday and Wednesday were the same. So what happens here with decreased sleep? We know there's increased sympathomimetic activity. We know there's also increase in pro-inflammatory markers. Normally Monday's already our most common day for an MI. So just think about that, just a little tidbit when you're sleeping tonight, and try to be careful on the roads. Hopefully nobody got in an accident today. Thanks.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.